Hi, I'm Dr. Dana Brackney, and I'll be your faculty member in nursing care of communities. Recently, the role of the RN in care of communities related to public health has been very prominent in the news. Viral outbreaks, including Ebola and the novel coronavirus, have increased the public's understanding of disease prevention, transmission, and vaccination. Terms like herd immunity and flattening the curve have become commonplace. This course will give you an opportunity to learn more about your community at the county level and about the RN role in public health. The nursing process in community health is the same as that in the acute care setting. First, there is an assessment. However, instead of inspection, we perform a windshield survey by visiting the community and looking, noticing, observing what's around. In place of vital signs, we use statistics to assess the health of a population. In place of the history of present illness, we interview key informants within a community. Then we define the health problem, our nursing diagnosis of the community, and select interventions that are directed at groups instead of individuals. In this video, I'm going to provide an overview of major course assignments and help you to prepare for success in our course. I have highlighted for you on the course calendar the different major assignments to help you to prepare for each week they're assigned. Don't think of the courses week by week. You must be constantly looking ahead and making plans for how to complete the more complex assignments in order to complete the course successfully at the level of excellence you desire. You will see on this course calendar that there are weekly graded and learning activities. These activities will provide you with a good foundation for the more complex assignments. For example, the first more complex assignment is the windshield survey. It's due in 3 weeks, but you should begin it now. It's important to actually visit areas of your county to understand the resources and needs that you can see. One thing that might be tricky to understand is that it is best in this assignment to use a county. I know if you're in Charlotte, you might think, how can I possibly do that? My area is so big. But trust me here, because of using statistics, and these are most often reported at the county level, you will be better served if you do your windshield survey on the county. You might ask, how can I cover the whole county, Dr. Brackney? I'm so busy. Well, please select significant spots, perhaps that are variable. Like in Mecklenburg, you might see a more rural area of the county and then a more urban area and suburban. I understand that you'll have to pick and choose, but please consider visiting places that you don't usually go within your county or you know less about. It will certainly make the course more interesting for you and selfishly more interesting for me. So once you've chosen your county and you drive around and see it, that's the beginning of your assessment. So you will have to actually visit areas of your county to understand the resources and needs that you can see. I'm concerned that if you wait until assignments due, you might not have enough time to complete it correctly. Likewise, if we look further down in week 7, this is another assignment that takes more planning. You need to be thinking about who might have information about a community problem that you've identified and make plans early to meet with that person. That person's called a key informant. It doesn't have to be a person in a high-level position, although it could be. Sometimes the best key informants are actually people that live in a neighborhood with a concern. But you can think about who those key informants might be in the community and make plans in this time of COVID to conduct a telephone interview of them. This should not be information that's just taken off a website. We'll do that in another portion of the course, a key informant actually involves speaking to a person with intimate knowledge of the problem or the solution for that you have identified. So that takes time and planning. Let's see, all of the assessment data you collect in the first 7 weeks of the course will be used in the week 8 assignment. This is often a difficult assignment for students because students haven't often had experience thinking about health at the community level. This assignment is the care plan and evaluation for the community, and you will use the feedback on your first plan, and you should apply that feedback that I provide to the second community problem that you'll be doing at the end of the course, your community plan number 2. So I want you to be aware that, and I'll show in a separate video how to access and view the feedback that I give, because I work really hard to get that back to you quickly so that you can learn from it and expand your thinking and understanding in the second assignment. Education is a common intervention in public community health. However, now you're asked to think about education of groups who are vulnerable to the problem instead of thinking about the individual. You'll be creating a public service announcement to address a community education need. This will be separate from the other 2 interventions. So it is not one of your interventions for your community health plan, but it is a course assignment here. And we're calling it a VoiceThread PSA, public service announcement. So you'll have more on this later. I mean, that's still 12 weeks away. So if you're feeling overwhelmed, I hope not. I just wanted to give you an overview so that you can manage your most important resource, which is time. I don't want you to be surprised by the uneven nature of the weekly assignments. Some weeks are lighter in their work than others, and that's intentional. So you have some time to work ahead on these more difficult assignments. So I am very excited about all that you will be learning in this course, and I'm available via email. I can set up personal voice or personal Zoom meetings with you. So just know that I'm thinking of you and trying to prepare for your success. Thanks and welcome to our course.